Good afternoon, Ma.
Afternoon.
Please, I would like to discuss a case with you. There's this patient of mine that seems to have a lot going on with her. And I would just like to know if I'm on the right track with her management.
Okay. Can we use the case-based discussion to guide this interaction?
Yes, I would love that, Ma.
Okay. All right, Dr. Kolade. So I have a copy of the form here. Let me pick one up. This is the version that we shared in the portfolio, the e-portfolio. And we're supposed to just select particular areas that we're going to discuss. And we'll just tick the competencies that we want to focus on.
All right, Ma.
I also noticed that recently the faculty has shared this version of the same form because that other one was a bit difficult to print. When printing, some letters were shifting, so we can also use this version for the discussion.
Okay, ma'am.
Okay, we are good to go. So what clinical competence area would you like us to review together?
The data gathering and interpretation.
Yeah.
Managing medical complexity and working with colleagues and in teams.
Great. So that's good. Okay, before we go to and use the tool, can you give me a context for this patient, please?
Yes, ma. She's a 42-year-old woman who has hypothyroidism following a thyroidectomy, and she's been off her levothyroxine replacement. She has suboptimal diabetic control. She's also mildly depressed based on the Hamilton Depression Rating Scale, and she has dyslipidemia and systemic hypertension. She just has all of these things going on in one person, and I've involved the clinical psychologist and the endocrinologist in her care, and I just want to discuss with you to see if I'm on track, especially because of her reason for encounter. Thank you.
Okay, that sounds interesting. So let's start asking some more specific questions using the tool. Right, thank you, Dr. Kolade. So there are lots of diagnoses. We're talking of at least 4 different diagnoses in this patient. So let's take it one by one. First of all, can you tell me what are the things in terms of symptoms and signs that helped you to make some of the diagnoses that you have?
Okay, ma. She presented with a history of apathy and generalized weakness that had progressively worsened over the past 1 year. And there was also a history of being sad, specifically because of some recent marital strain. And looking at these features, I felt hypothyroidism and depression were kind of overlapping in her. And from her physical examination, I saw that her body mass index was quite elevated, which could be a feature in keeping with the hypothyroidism. And she also had isolated diastolic hypertension, which could also be in keeping with the hypothyroidism.
Okay, good. So what bits of information do you find most helpful for her?
I found her presenting complaints quite helpful. And in particular, I also found that her past medical history, the history of the diabetes, the history of the thyroidectomy she had, and the fact that she wasn't using her thyroxine replacement was also very important in her. And the reason for encounter she gave also gave me some vital clue to what could be going on in her.
What was the reason?
She presented because she was actually trying to conceive. That was her major reason. And so from there, asking her questions, I found out that she was having a strain with her husband currently because she found out he just started having an affair.
Oh.
And she feels this is because she's not been able to conceive for the past 6 years of their marriage. And she's concerned that he may eventually leave her for another woman.
Okay. So what other information did you find help you to make a diagnosis?
I also made use of the Hamilton Depression Rating Scale, which placed her at mild depression, and I was also able to make use of some of the results of the tests she brought.
Okay. So can you tell me about these results and how they helped you?
Yes. She had done a thyroid function test recently, and it showed that she had a markedly elevated TSH, whilst the free T3 and T4 were quite low. And she had hemoglobin A1C of 13.8%, suggesting that she has a suboptimal glycemic control, and she had dyslipidemia.
Good. Now, What skills are you proud of in that you're able to demonstrate when you got the history from this patient?
I was really able to maximize the component 1 of PCCM, exploring my patient's illness experience. That really brought out a number of things in this case. That brought out the fact that her boss had talked about her functionality at work, her being sluggish, not being optimal, brought out the fact that she felt her symptoms were because of the strain she was having in her marriage, and then her expectation also helped me to know she was trying to conceive.
Okay, good. What examinations did you perform?
I did a thorough head-to-toe examination on her, starting with the mental state examination, cardiovascular. I practically went through all.
Okay. Let me ask you this. Have you gathered any further information from the case notes, from any other source?
No, I haven't.
Okay. Last question. Was there any other information you would have liked that would have helped you?
Well, maybe also listening to her husband, like hearing what the husband feels about her, whatever he's noticed about her in recent times. That may also be helpful.
Okay. Well, I'm happy with what you've done in data gathering, so I'll give you a score of excellent. Good. Okay, so let's go to working with colleagues and in teams. The first question I want to ask you, did you involve anyone else in management of this patient? And if you did, why? And how did it help?
Yes, I involved the clinical psychologist because of the assessment of mild depression. And that has been very helpful. She's had a first visit already, and she's been scheduled for subsequent visits, and I believe we're going to have some good outcome. And I also involved the endocrinologists because of the multiple endocrinology disorders, the diabetes and the hypothyroidism.
Okay. Did you involve any organization in this case? Do you think that might be helpful? Are there any organizations that could support?
No, I haven't involved any other organizations.
Okay. How did you ensure that you had effective communication with the other doctors you mentioned and the psychologists for her?
For the endocrinologists, I actually put a call through to the endocrinologist and discussed the context because I wanted her to be able to get the full context of this patient. That was in addition to my referral letter to them. And for the clinical psychologist, I sent a referral letter. And I've also spoken with them afterwards.
Okay, good. That's good effort. Now, this person has how many people now involved in her care? About 4 or 3?
3 for now.
Yeah. And then with you, a 4th person. So what do you see your role being here?
Basically in coordinating the care of this patient, seeing that she has all of these things going on with the psychosocial stressors, the medical issues, and so I'm there to coordinate her care. So I'm going to keep having follow-up appointments with her to see how she's making progress.
Okay. Do you think you are also providing her a safety net?
Well, I think I'm trying to do that. I'm also trying to involve her husband in her care because I realized that there would be a need for a couple counseling. So we've scheduled that for the next appointment.
Okay. I'm happy with what you've done. I will score you excellent in working with colleagues and in teams. So let's go to the last part, which is on fitness to practice and awareness of your own performance. Now, this first question, are there any things that would make you be concerned about her? Maybe some features that you would say, oh, this is a sign of alarm. I need to be able to escalate care or I need to refer?
Yes, I did ask about suicidal ideation and any attempts so far, but she didn't have any of those. So I was really particular about this because of the history suggestive of depression. Okay.
Is there any other thing you want to watch out for, considering that she's hypothyroidic? Are there some features that you want to say, this should be a warning sign to escalate care?
Yes, well, now she's commenced her medications back, so I'm hopeful that she wouldn't have any of those features that could suggest tilting into myxedema, coma, or the likes. So I'm hoping she wouldn't have any of those.
Okay. So I'm going to ask you about safety netting here again. How did you close the consultation, and what were the recommendations you gave her?
So I asked her if she understood all that we had discussed in that consultation and if she was fine with involving the other colleagues in her care. And she was fine with this. And I scheduled another appointment with her on a convenient date for her as well. So we're to see in the next 2 weeks, when I'm hoping she would have had another visit to the clinical psychologist already and the endocrinologist as well. And she was fine with these.
Okay, if an emergency were to happen before the 2 weeks appointment, did you give her any guide on how to approach us?
Yes, I let her know she could always present either at the emergency or the general outpatient clinic if there were any emergencies during the regular work hours between 8 to 5 at general outpatient clinic or afterwards the emergency.
Okay, so I'll give you an assessment of competence for this fitness to practice.
Thank you.
So thank you very much. It was a good discussion.
Thank you very much, Ma.